I did most of my medical education at UC San Francisco. I did 2 years of my residency at San Francisco General Hospital and my third year at the University of Minnesota. My original training was in family practice, and I did that for 13 years. And in many ways, I think that's actually an ideal background to come from for this specialty. After doing 13 years in family practice, I was getting a little restless, and I realized what I enjoyed most was doing procedures in the office where I could see something getting better, could have an immediate positive impact on people. And it just happened that around that time there was a group that was opening offices around the country that contacted me. I had never heard of this. I was very skeptical. I had to spend days in the library to even find any articles at the time, because back then, 1990, this was really an unknown field in this country. Eventually I decided it sounded like it would suit me very well. I left my family practice, went through 3 months of intensive training, and opened this office. Eventually, I separated off from that group and have been in solo practice since then, but it's been a very, very gratifying specialty to be in. I've been here since 1990, back in the days when I was considered what one friend called an O doctor, which is to say I would go to the doctor's lounge in the hospital, and they would say, "Well, what are you doing these days, Mark?" And I'd say, "Well, I do phlebology, I treat veins." And they would go, "Oh." It was kind of one step above being a quack, but over the course of time, it's gained more and more legitimacy, and it's been taken much more seriously, as evidenced by the fact that there are so many doctors now who are trying to learn all of the techniques that we're using. But I've been in it from the beginning and was one of the main people that started integrating the use of ultrasound into phlebology practice. I was one of the original 4 people that did the FDA trials for endovenous laser, so I've got a lot of long experience. I've been on the faculty of the American College of Phlebology for years and years, and in fact I'm teaching the course for people who are taking phlebology boards. So I think I have a lot of credibility in the community, and having come from a primary care background, I've been very careful to keep referring doctors as well as patients involved in the process of what's going on, decision-making, making final decisions about treatment. And I think that over the course of time, I've gained enough credibility in the community so that most of my patients come from doctor referrals now as opposed to advertising or whatever. It's very important to my staff and to me that people feel welcome when they come in, and that they understand I'm not an authoritarian doctor who's going to dictate to them what they need to do. I see this as a joint decision-making process, and a lot of what we do right off the bat is education. So sometimes over the objections of our patients, we have them watch an education video that really is purely educational. It has a lot of information about vein pathology and treatment options that go beyond what you would find in most offices. In fact, I tell patients quite seriously that by the time they're done with their first consultation, they'll probably know more about vein disease than the average doctor in this country. And then from that point on, we look at options, we talk about what's available, what I feel might be best for their particular problem, but also what other options there are, and we plan out the treatment together.